Okay, we'll give it a few more minutes and let everybody log on. We're almost at the top of the hour. We'll start in another minute here. Good morning, everyone. Welcome to campus training for insurers, self-insurers, and third-party administrators. I'm Denise Holmes, and I'm a Compliance Services Officer in the Compliance Records and Training Department at the Minnesota Department of Labor and Industry. And we also have with us co-presenting my CRT teammate, Senior CSO, Deb Dolsky. We're both excited to share this course with you today. We also have with us on the panel CRT Supervisor Melissa Parrish and our campus subject matter experts Lisa Smith, Cheryl Sherbel, and Lynn Knowles as well. Please note that for audio purposes, all attendees are on mute, so if you have a question that arises during this presentation, please just type it into the chat box. Our medical policy specialist, Lisa Wichterman, will be coordinating the chat box inquiries for us all today to ensure that all of your questions are answered. So next, for some context, Deb Dolsky will briefly touch on the focus of today's content. Deb?
Good morning, everyone. I just wanted to add that we are all going through the rollout of campus together. We look forward to a new system that allows easy access for all parties to a workers' compensation claim. We will work together on the transition to campus and help one another out. Also remember that after the go-live date of November 2nd, there is ongoing assistance with the transition of the new system with the utilization of the help desk. Denise, do you want to continue with the agenda for today?
That sounds great, Deb. Thank you for sharing that with us. And so, as you can see for the training session today, we plan to go over the entity dashboard view, which includes the entity details page and various tabs, including the entity status. We will also go over the claim view, and that is where you'll be able to submit a filing, including e-forms and web forms. So I just want to point out that the next slides, number 3 to number 15, give snapshots of the campus screen views that we will be talking about today. And you can certainly refer back to these slide deck screens in the future as a refresher if needed. However, for purposes of our presentation today, we're going to do a live demonstration of these screens instead so that we can walk through them together in real time. So bear with me a minute here while I switch over to the campus system. Deb, can you see the campus homepage?
Yes, I
We can
can.
see it. This is
The
Melissa.
overview, yeah.
Great, thank you. So this entity dashboard is the view that you'll see when you first log into the campus system. And I want to point out a couple of basics to keep in mind, that this top toolbar up here that's navy in color, you'll see this at the top of any screen that you're in campus, and a few buttons that you'll be using a lot as you maneuver through this new system will be on the upper left-hand side. This Minnesota Department of Labor and Industry, this is a hot button. So basically, whenever you push this, no matter what screen you're in, it will bring you back to this main campus homepage screen. So if you're ever working through the system and you get lost and you want to start over, just click this button and it will bring you back to this homepage here. You'll also note in this navy toolbar that there is a submit a filing button here. And below you'll see then the different filings that you can file. You'll also see on this toolbar the notification bell, which would show the number of messages that are unread that you need to view. And then in the upper right-hand side of that toolbar, you'll see your name. So I am, for today's demonstration purposes, my name is Tuesday Another. So you'll see your name there with the drop-down menu. And in the drop-down menu, you'll see some options: editing my own profile, my groups, and when you want to log off the campus system at the end of your task, you'd click this log out button here to sign out. Okay, so that's the toolbar there. The other thing I wanted to point out is at the when you scroll down to the very bottom of this campus homepage, you'll see the phone number for DLI if you have any questions. That's the help desk. If you have any questions, go ahead and call the local number or the toll-free number, and we'd be happy to assist you. So let's start with the My Overview section up here in the top left. Basically, this section here shows how many open claims you have that are going to give further detail in this MyQ portal below. It'll show your number of upcoming events that you have on the calendar. It also shows how many new documents you have ready to view in your notification panel. Next, I want to point out on the upper right-hand side of this screen is your notification panel with the bell icon. And so you can see those. If you're done viewing each one in particular, you would just X out on the ones that you want to go away. If you hit this clear all button, of course, they'll all go away. So make sure you only click on the ones that you're done reading and working on. The next section to pay attention to would be the My Cues section. And this section here displays various tabs that you're going to be using to do your work. And the tabs that show up here may be a little different. There may be some additional or some missing depending on your permission levels and your role. Not everybody's going to be dealing with special comp assessments, etc. And so next we're going to run through the tabs in the My Cues. The other thing I wanted to point out actually before we do that is the last thing on your main homepage for campus is going to be the My Events section. And this is where your calendar is of the claims. If you want to open it up larger, you'd click on that Open Calendar button. And here you see in better detail, you can see the month that you want to view. You can also change it to a week's view if that's your preference. Now, when you want to go back to the prior page, common sense for y'all, but I just want to call out what I'm doing. I'm going to click the left arrow in the upper left-hand screen, and that'll take me back. The other option is I could have just clicked the campus homepage link in the upper left-hand side. So the other thing to point out about the calendar is if you don't like looking at it in this calendar view, you can certainly choose to look at your events in a list view instead, whatever your preference is. Okay, so let's get into the tabs under the My Cues. One other thing actually I do want to show you is when you're in this entity dashboard, when you go up under your name, to look at the entity details page, you would click up here under your name in the drop-down menu, click in the My Groups selection, and then you'll see that it loads a hyperlink for the insurer, UAT another one. This is obviously a made-up claim, made-up insurer name, so bear with us here. You can see on this page that I, being Denise, or Tuesday Another, that's my name, you can see what permissions I've been given in this campus system, that I'm signed up as the designated contact for penalties. I'm the designated contact for request for information letters from Dolly, and I'm a group administrator. I'm a contact for assessments. So you'll all have different permissions depending on what your particular role is with your own entity. Now, to see the entity details page for this insurer UAT1, you'd click on the hyperlink here, and it will load the entity details. And that includes basic information such as the entity's name, the insurer type, the NAIC and FEIN numbers. It also shows the insurer's status. Here you see that this UAT another one is active. And it also would show if the insurer is bankrupt or not. And then the tabs that you would see when you scroll down below, such as addresses, you can add addresses here. These tabs that you'd see vary depending on your permission type. So for the addresses tab, if you wanted to add an address, you would click this button here on the upper right hand side here of this bar, and then you would click the save button. You'd fill in the information, click the save button, and basically that would be sent off to DLI, that updated information for approval to be formalized in the system as an edit. The next tab that you'll see here is the Contacts tab. And this would show all contacts that are identified by the entity. These would actually be added in by a DLI entity administrator. We don't have any here because this is a big claim, so bear with us here. You'll notice if you click on something that you don't have permissions to, you'll get this screen saying you're not authorized to access this page, you don't have permissions. So that's an example of what can happen if you click on something, try to go somewhere that you don't have permissions to. The next tab that we have is the insurer's transaction history. And this would show all EDI and e-form transactions that have been submitted for an insurer entity. And this tab here is only going to be available on the insurer or self-insurer details page. The next tab that we have here is the Insurers Relationships tab, and that shows all entities that they're related to. This view would give the entity, the related campus's entity ID, the name, the FEIN, the relationship, the start date and end date of that relationship. This one here is ongoing, so there's no end date, and the relationship status. Please note that if you are a third-party administrator, then you're going to have an additional tab that we don't see here. It would be a related insurers tab, and that would show you all different insurers that you, the different insurers that you handle claims for. So that would be there if you're a TPA only. The next tab is one that not everybody will have. It depends on what your permissions are, and that is the Special Comp Fund Assessment History tab. So if you're identified as a designated contact for those assessments, then you'd see this tab. And underneath the tab shows basically the history of this insurer's reported assessments. It displays the assessment ID with the hyperlink. If you want to see further detail, assessment year, total amount due, assessment status, and penalty status. And one thing just to point out, just for functionality in these menus here, because this is a full claim, we only have, you can see 4 items. However, if, you know, in the real system, when you have a real claim, if it's an older one, you're going to obviously have more than 4 items here to look at. You could have multiple pages to look at. So if you want to sort through and find a certain assessment year, let's say, in particular, if you want to narrow down and just pull those forward, on these tab menus on the right-hand side, there is this filter funnel button. So when you click on that, it'll pop up here some options to sort by. And so we're going to do assessment year. Let's say we just want to see the ones from 2019. You must click apply. You can't click enter. Just FYI, it's mouse-based. So left click on the apply button and it'll do the search for you. And you can see it narrowed it down to just 2019. So that's just kind of a helpful tip in how to maneuver around and get less results if you're looking for something in particular and you have multiple pages of data. The other thing I wanted to point out is that when you have a lot of data, the default is just to show 10 items per page, which can be a lot of pages on an older claim. And so you can click the drop-down menu here. And as with any system, you just click and increase the number of pages if you want to show more at a time. So let's move on to the first action tab. And this shows, let's let it load here. This shows the insurer's reportable lost time claims and the timeliness of the first action on those claims. And these are claims that are reported within the fiscal year, so from July 1st through July 30th. And so you can see this table here shows the total number of reportable claims in a year. It'll show, again, timely and untimely claim information. This first action tab also includes a list of all of the claims that are determined to be first action eligible, including the reporting year, reporting date, date of injury, employee name, JCN number for the claim, if it was timely, and then the MTC or form code. And again, if you have a lot of them, for 2020, you can use this filter tab. to further hone down to what it is that you're looking for. So this information for first action, it's only available on the insurer detail page and the trading partner dashboard. So the next tab that we're going to look at is the Related Claims and Cases tab. And so you can see here it shows all of the claims, the disputes, and the other transactions that are related to this entity. It shows the associated ID number, which includes a hyperlink to the case or the claim, the associated name, associated type, the employee name. So here you can see, although we have five items, you can see it's really just on two different claims. We had the Monday tester claim and Susie UA test. Those are the two fake claims that we set up. So,
hey Denise.
Yes,
we
Lisa.
have a question from our audience.
Great.
When we on the first action tab, the question
Yes.
is, I mean, when you showed the prior years, they were like 0, I believe. The question is will all the prior years be loaded when the system goes live?
That's a good question. Can I throw that one out to the panel? Is anybody aware of that?
Yeah, this is Melissa, and I don't, Cheryl or Lisa, I don't know if you know better. I don't know off the top of my head if it would just be the reports that people would see or if the data will be loaded, but we can take that question down and get an answer to that. Definitely a good question. Thanks.
Thank you, Melissa. Lisa, any others?
We have a couple other questions here.
Okay.
Here's one. Do you know when we can register, and would we be able to access campus to practice moving around from the section to section?
I can help answer that. So when you will have access, the campus will go live, the system will go live on November 2nd. Unfortunately, we cannot go outside of our VPN network as things are still being developed. So we don't have access to give right now for people to practice ahead of time. And with COVID, we were of course limited with bringing people in for, of course, not everyone's local, but we had some hopes and plans for some third practice sessions that we are unable to do. So really it will be on the go live date of 11/2 and forward when you can register and actually get into campus.
And we have one more question from the chat before we move forward. Just real quick, if you can just explain what first action means.
Okay.
Sure. Go ahead, Denise, sorry.
Sure. So the first action tab, first action would be claims that need to be reported because either there are going to be some permanency anticipated to be involved. It could be a serious injury. It is an injury that involves some lost time or wages, and therefore indemnity benefits would be incurred. And as you know, when that happens, you have a limited amount of time in order to file your first report of injury into the system. Melissa, do you have anything to add to that explanation?
Sure. Yep. I'll just add that we do set out an annual report every year with the insurer's information on timeliness when it comes to first action. So we do get that first report of injury in, and then on claims where there is claimed lost time or wages beyond that 3-day waiting period, there needs to be a first action. You might accept a claim and pay indemnity, you might deny the claim, or you might do a partial denial. But what happens on the claim is that first action, and then there's the statutory limits of when that needs to happen within those 14 days. And so we track the action and also if it's timely or not and put out an annual report. And that happens in January that the report comes out.
Thank you, Melissa. Lisa or Mike, do we have any other questions in the chat box that are pending, or should I move forward?
Yes, we got one more question here. Will we be setting up access to the campus as individuals, or will our organization have to register for all employees to have access?
That's a good question. If you don't mind me still talking here, I'll go ahead and answer that. This is Melissa again. So all of the organizations have been contacted with a survey to kind of set up a group admin for your industry, for your business. And if you've been contacted, you know all about it. If not, someone has been contacted with a survey and information on who is going to be the group admin, and they're going to help with kind of setting up and also doing the permissions for access as your business. There is very specific group admin training that's coming up tomorrow and next week. I believe we're talking about it later in the session as kind of a reminder and a heads up on that. So I won't get too far into the details, but there is specific training to that group admin role that people are encouraged to attend that will help as well.
Great, thanks, Melissa. So let's pick up here, if we can, on the Related Claims and Cases tab. So as I was saying, this tab here, it's going to show all claims, disputes, and other transactions related to an entity. And you can see here, even though we have 2 claims, there are 5 items listed here. So something to keep in mind. Obviously, when you get in the system, you're going to have more than 2 claims. So again, if you need to hone your search, use this filter funnel button here and put in the column the values that you need, and that should help you locate what you're looking for. The other thing that I wanted to point out on this tab here is that you'll notice here in the upper right hand side of this tab box, there is an include inactive claim. So if you want to include your inactive claims in your search, you want to be sure that you click that box. The default always sets to just your active claims. We have 2 active claims right now in this fake test site for our demonstration purposes today. So the other thing that we want to show you today is, let's go back to the campus, the main homepage. So we're going to do that by, again, our friend is this button in the upper left-hand side. The hot button, Minnesota Dolly, takes us back to the main campus homepage. And I'll point out, you'll see here this green bar that was going left to right multiple times. That's kind of like on other systems, the arrow going in a circle. That just means be patient. The system's loading the details for us. So when you see that, give it a moment, it'll load. So here on the main campus homepage, let's say that we wanted to view a particular claim's details. So what you would do is scroll down, and when you're in the My Claims tab, you would click on the campus file number of the claim that you want to see. So let's say we want to look at this one here for Monday Tester's injury claim. So we'll click on this hyperlink. And you'll see that it loads a lot of claim information summary details for us. So what you'll notice is the claim number up there, which obviously corresponds to the campus file number. Only difference is the CL in front. See? You'll see the employee's name. You'll see the injury date, claim status, it's open. Here, this is a full claim that we've set up, so it doesn't have it, but what you would see here would be the body part injured. You'll see other information summarized just for a quick glance, like the employer, the insurer, the claims administrator, and then the claims administrator claim number. The next section that you'll see, and first I want to do this, I want to point out, so this is the stuff that the information that is summarized at the top, that basic information. However, you'll note below there are different sections that are expandable by clicking the tab on the right-hand side, the arrow. So I just want to point that out. In the other format of this screen, so you have the basic summary information at the top, You have the expandable sections with further details. And then at the bottom, you have, just like all the screens, the different tabs to move around between to get further information. So let's start with the Claim Overview tab, and we'll expand that here first. So what you see here is this is showing us that this claim, it was denied by the insurer. And we know that because it's highlighted in green and it's checkmarked. So we can see that from quick glance, excuse me, by looking at this section, Claim Overview. That's what that tells us. So let's move on to the Claims Detail section. We'll expand that, and you can see here the campus file number, that it's a medical only claim, date of injury. There'd be a time of injury pulled in here, the employer, employee, insurer, insurance status. You'll also see here, this is again a full claim, so you can't see the narrative, but the claim narrative would be listed here with further information for you. And then if this happens to be a work comp claim for an injured worker who works for an employer that's managed care, then in this section here, you'd see the managed care provider, the organization type, and the organization name. So that is the breakdown of the claim details section. We'll go into the key date section, and in here you see the date of notification, the date the claims administrator or the third-party administrator were notified of the injury. There's MMI, maximum medical improvement, that date would go there. And then the date the claims administrator was notified of disability beyond the 3-day initial waiting period. You'd see the date there as well. You'll also in this section see the initial period of disability benefits details. So the date the disability began, the last date worked, and then the date the employer was notified that the disability date was related to the work comp injury will be listed there. So if we move down into the injury details page here, or section here, you can see that it's going to show the body part injured. It's going to show the cause of the injury. Again, this is a fake claim, so this isn't probably a realistic cause of injury for a fracture, but that's what was selected when the claim was set up. So you see cause of injury, nature of injury, type of loss, if there was a pre-existing disability, birth date, and then you'll see the accident injury description and source of injury information here.
Hi, Denise.
Yes, Lisa.
We have a couple questions from the chat.
Sure.
We have a question from Christine. It says, are we to update all that information, or is it something that you guys update? Where does this information come from that gets into the injury details?
Sure. Information like for the injury details, here we're talking about the B, C, and D codes. Those things are going to automatically scrape or pull from the injury report that gets filed. Melissa, do you have anything that you want to add to that as far as where all of this information is coming from?
Yeah, absolutely. Good question. So the trading partners, anyone who's submitting claim information to us will be submitting via EDI. And as most of you or many of you already know, you can either do that as a direct connect where your system is set up to send the information to us. You may be using a vendor, many of you are using vendors to send the information, or using the e-forms where you are doing data entry for like the FROI and the SHROI transactions. So when you are submitting as a trading partner and vendors, when that information is submitted, that information is what is updating the claim here. So the claim will be a reflection of the data that you are submitting.
Okay, thank you, Melissa.
We have 2 more questions in the chat.
Yes.
This next question is about medical only claims. It says usually state forms are involved in accepted medical only claims, and thus DLI is not informed of these. Will all claims need to be reported to DLI now? So I believe the question is, do med only claims need to be reported along with lost time claims?
So that it remains mostly the same as what we do right now, the medical only claims. So again, if there's no claimed lost time or wages beyond that waiting period, you don't necessarily have to file the claim. Now, moving forward with campus, if there is a litigation or rehab, then those will need to be filed with us. So you might land in that category. And then also we find in the past, and I'm sure moving forward, that some carriers choose to report even a medical only claim. Perhaps you want to put a denial on file, or perhaps it's a medical only claim right now that you are anticipating will change in the future. And therefore you want to submit the FOIA now just to get it kind of get it done. Or perhaps it's just, sometimes we get them by mistake. Someone just files medical only. It's fine. You can do that, but it is not required if it doesn't hit those other criteria.
Great. Thank you, Melissa. The other thing to keep in mind is you would want to report it, obviously, if at some point it appears that the injury is going to result in some sort of permanent partial disability, because an indemnity benefit would be paid in the future. So that's another time that you would want to file the report. You have another question, Lisa, for us?
There are. Okay, the next question is, please clarify exactly what pre-existing disability stands for.
Oh, I can answer that. So the pre-existing disability, that is a EDI data element that comes from, as many of you are aware, the IAIABC. If that sounds like alphabet soup, you might not be as involved with EDI, but the governing body for EDI. So the pre-existing disability code, it's an indicator, and it identifies whether or not there's existence of a disability that existed prior to the injury. And it is a required data element on like Troy claims, so the subsequent report of injury claims, and you can either say yes, no, or unknown.
Okay.
And then the next last question here is, when is the go live date?
Monday, November 2nd is the campus go live date.
And we actually have 3 more questions here.
Sure.
What if there are multiple body parts? Is that multiple MMI date location?
Let's see, multiple body parts, but the MMI location.
So let's look. I believe that was under the claims detail page. Wait, might have been under key dates, excuse me. The key dates section had date of MMI.
So that's going to be what's applicable to the claim and not necessarily to a specific body part, I believe. So yeah, it would be the MMI date for that claim. And sometimes we'll see it change. Like sometimes we can see an MMI date that a doctor will then, revise as something unexpected happened. Yeah. Sorry, I hope that answered the question.
So that date, what Melissa's saying, that date of maximum medical improvement, that may change depending on what you have going on in the claim.
Okay, we have what? Oh, I'm sorry, go ahead, Mike.
Yeah, I have another, I think, 3 or 4 questions left here. Will all of these fields be automatically filled in on older claims from the 1970s, 1980s, 1990s?
Good question. We are migrating the data from our current system into campus. So we will have the claim data, everything. And of course, like something that we received maybe in 1970 might not have all the same data of a claim that is received now, just because things have changed as far as what's required to be filed. But the data we do have will be migrated. And then your trading partners will know that they will be submitting an acquisition transaction when we go live in campus, and basically is reintroducing that claim as being one of your claims in the new system. So they will file an acquisition and AQ transaction to say, hey, this is a claim that we're handling right now. And that will help us connect that claim to the correct trading partner claim admin.
Okay, another question here. Will subsequent periods of disability be displayed or just the initial dates?
In the tab showing the initial period of disability details, that's all that's going to show under the key dates tab. However, there are sections below like benefit and payment details, which we'll look at shortly here, which will show additional periods of disability.
Okay. And is there a timeline for filing a FROI on received claim petition? On a received claim petition.
Yep. So the timeline for filing a FROI is a 14. It needs to be to DLI on those claims that are reportable, as we talked about with the claim petition. With the litigation, it would be 14 days from the date of employer knowledge. And so, if that claim petition being filed is the first date of knowledge, you'd have 14 calendar days from then. If there was knowledge before and it was a reportable claim before, then you'd have 14 days from the date of employer knowledge that it was a reportable claim.
Okay, and is there a way to edit after a FROI is submitted? Example, a second body part is added after the fact.
There are ways to edit the EDI submissions, and depending again, if you are a direct connect or using a vendor, you would submit an O2 change MTC, so an O2 change form. It would either be the FROI or the SHROI, depending on what data is being amended. If it was you're amending data from a FROI, or you do the FROI O2. If you're amending data from the SHROI, you do the SHROI O2. And same with if you're doing our e-forms, you would go into the system to do your e-form submission and use the O2 change submission for that.
Any other questions out there, Mike or Lisa, that you see?
I have a couple questions in the chat. Is the campus claim number the same as the WID, the WID number?
No, the WID or worker identification number will stick with an employee for the life of their employment, no matter where they're working. So there'll be one WID number for an employee. However, obviously, the claim number would change depending on which date of loss you're talking about.
Okay, and the next question is, there are times when you need to get MMI from two different providers related to two different body parts. Is there a place for both of these dates?
Yeah, actually, this will tie right in. If I can speak to the answer hour that I'll be doing tomorrow from 10:30 till noon. Many of you were on my answer hour last week, and I went through the discontinuance web form and the benefit addendum web form. Tomorrow, I'm going to talk about the dependency web form and the PPD follow-up web form. On the PPD follow-up web form, when you are putting in the information for the PPD that is being paid, you have a space to enter the MMI date. And so if you end up needing to do multiple of those web forms to show perhaps a PPD rating for a shoulder that has an MMI date, and then maybe another one for a PPD rating for a knee that has an MMI date, you are able to enter that MMI date on that web form multiple times, because you can submit it multiple times.
Great. And Lisa, are there any additional questions out there?
We do have a couple more questions. So if we use a vendor to file EDI, what would it be our purpose to use this program?
Well, that's a great question. So even if you are using a vendor and they're filing all your EDI forms, you will interact with campus in some situations, like the web forms I talked about. I won't go into too much detail now. There is the training from last week is recorded, and we can certainly ask more questions if you guys have them. But if you are discontinuing for reasons other than return to work, there's a discontinuance web form that must be filed in addition to the correct EDI filing. So as a claim admin, you would log in and you would submit that web form in that case. Also, the benefit addendum web form are the ones I'll talk about tomorrow. And then also, if you get a request from the department, much like the requests that come out now, you might get via email or you might get paper mail. You'll be getting campus notifications of requests that you can then log in and respond to the requests by uploading documents or information that way.
Okay, and the next question is the WID number somewhere on the claim in campus?
Yes, it is. So you are on a claim, Denise. If you scroll down to the tabs, And
Okay.
there should be a parties tab at the bottom.
Mhm.
And you are on employee. And if you look right there where her cursor is, the ID, the EE number is the WID number. And also the WID is always sent back along with the JCN, which is the jurisdiction claim number, also known as the campus file number. I know we have a lot of names now, but that WID number and the JCN are always sent back on the acknowledgements when we accept a first report of injury. So your trading partner and vendor, et cetera, get it that way, but also you can find it in campus.
This is Cheryl. The employee number is also under the claim details section.
Oh, good call. Thank you.
Right here. Thank you, Cheryl. Another place you can find it. All right. Any other questions out there?
Just one more before we go forward. Can you explain what a SHROI is?
Sure. So right now, in our current system, trading partners must file the FROI via EDI. So we receive that. And then after the FROI comes in via EDI, you're all very used to mailing or faxing in paper FROIs like the notice of primary liability determination, the notice of benefit payment, the notice of benefit reinstatement, all those forms. Those forms in the new system will no longer be the paper forms. They will be EDI submissions like the FROI is now. But they are the subsequent report of injury forms. So they are the SHROI forms. So we've got the FROI currently. Moving forward, we will have the FROI still, and we will add in the SHROI as far as EDI reporting goes.
Any other pending?
Yeah, we have a couple more. Let's see here. Scroll back up here. When we receive a claim petition, 99% of the time, we don't know if we are going to accept or deny the claim. And sometimes the investigation takes several weeks or months to determine. Do we file primary denial initially and just indicate that the denial field that we are denying pending additional investigation? How do we avoid penalties? Is there any special language we should use?
Deb, you deal with penalty reviews for NOPLD denials. Is this something you might want to speak a little bit to?
I think when you're filing your initial first report of injury and your denial of primary liability, you do have to put a good forth effort in your investigation at the time that you receive a claim petition. I think the question was about claim petitions. So what I would suggest that you do is to conduct an investigation as best you can and submit that information into the department. And once we receive that, we will review it to determine if the denial is adequate. And if it isn't, we will, submit additional information to you asking for additional details.
So just like before, you don't want to file a non-specific denial. You need to file a specific denial, clearly explaining in understandable language to the injured worker the basis of your denial, the objective and legal basis of your denial.
That's correct.
Okay.
Yeah, we have a couple more questions.
Sure.
This is from Lisa Leopold. It says, is there a list somewhere that shows which forms are to be filed EDI and which forms that are to be filed on DLI's website?
Yes, good question. We do have some quick reference guides available on our website, and let me navigate there. I believe we're going to talk about that at the end.
Right. This is Deb. I'm going to go through some various helpful websites, and on there will be various help guides that will assist everybody with that.
Including the MCT forms.
Correct.
Great.
So we will get to that shortly.
I got two more questions.
Yes.
The next question, is there a choice to either one, file a SHROI through the trading partner versus adjuster going directly into campus to enter the information?
Yeah, so the trading partners, to be a trading partner, you need to fill out the trading partner agreement. And unless you're brand new to this, which happens, and you might be a new company that needs to submit one. Otherwise, your current company, or you have already submitted a trading partner profile and have been sending in EDI FROIs for quite some time now. But as part of that trading partner agreement, you will indicate to us how you want to submit your EDI filings. And at that point, you can either say, we are a company that wants to direct connect. We are going to do the programming on our end to set up with your programming on your end. There's all sorts of fun IT stuff that happens in there that is well above my IT knowledge to actually make that connection and then submit the EDI directly. You might also, as a trading partner, say, we are going to work with a vendor who is well-versed and this is what they do, and they will set it up for us. We will give them the information and they will forward it on. Or that third option being that we will not be sending direct or through a vendor. We will log into Campus and do the data entry on the forms to submit our e-forms, the FROIs and the SHORIs. So that really is a decision that your trading partner gets to make of how you want to handle that. And I'll just put in a plug, if you have other questions about that, we do have an EDI email address that you can ask questions to. So talk first to your EDI team in your company, and then you can always email us at dli.edi@state.mn.us.
Great, thanks, Melissa. So it looks like, Melissa, there's a question here from Sean Carmody regarding what should be filed on asbestos-related claims against multiple employers and carriers. I know that you oversee asbestos claims. What can you share with Sean about that process?
Yeah, as I talk here, I'm going to try and go to my my page, because I think that was a frequently asked question even on one of our guides that we can talk about. But we will expect to get information, the FROI submitted and claim documents submitted for those claims. Right now, we've always kind of just verbally told people that we are combining the claims and we kind of treat them as one big claim. In the future, you will submit one for each of your claims. So if there's 4 employers involved and you're handling one of them, you will submit your FROI, and there might be other carriers that are submitting the other FROIs for that same asbestos claim, but with other employers and insurers. So you will be submitting that information, and then I will, if it's not part of the talk later, I will put in a link for the FAQ guide for EDI and e-forms, and there is some information there as well about asbestos claims.
Great.
And sorry, can I just add, I apologize. And this will be the EDI information as well that will be part of, if you look at the EDI guide and some of the documents we can talk about later. But we do have in EDI, it's a maintenance type code, MTC, the different types of kind of forms that you're submitting, but it's through EDI. And there's one called the UI, the under investigation. We are utilizing the UI for asbestos claims because of the very unique qualities related to an asbestos claim. And frankly, because some of those claims there might not be a lot of data on because they can be so old and maybe employers are long gone. So we couldn't have we didn't want to have the same requirements for data because they would reject if data is missing. So the UI claim is very specific to asbestos claims and can be filed in those cases.
Okay, and it looks like there's a question from Jamie McCoy. For the notifications responses required, will those go to the adjusters directly or to the person who filed the EDI in the case of compliance handling this element?
Good question. So that is part of the group admin, the group management that someone at your company will be maintaining. And when they are assigning access to claims and assigning who can view what and who does what, they will be picking, your company picking a contact to receive those department requests. We are going to highly recommend, if you have like a group email that can be accessed by more than one person, for example, that perhaps if my company was Melissa Insurance Company, I would want a generic State of Minnesota requests at melissainsurancecompany.com email address, so multiple people could view that, or however it works for your business as well. But you will be able to determine who gets those requests.
Okay.
Yep. There's another question from Adrian. It says, if we have a contribution claim for a Gillette injury, there are potentially several carriers listed for the same date of injury. Are we able to see certain information from all carriers?
You would have access to your own claims, but if there's a different carrier that submitted a claim, if you're not a party to it, you would need to be granted access to be able to see it. So I think just offhand, no, you wouldn't be able to log in and see the other carrier claims. But I hope that answered the question. If that's not it, maybe put another question in there and we can also get back to you on that.
And it looks like there was one more question in there from Jamie Lynn Cribb. I just wanted to make sure if we have a vendor that we use for EDI, we can use them to report to the state. The claim information will be added into Campus by you. Then we can use the forms and submit the forms.
So when, if you're using a vendor, they will be submitting on behalf of you the EDI, the data, to us via EDI. So we get that data and we in Campus will be absorbing that data and then displaying it in the claim. So yes, we are taking the data submitted to us and we are putting it in Campus where you can then view what you have access to here. Depending on the EDI transaction that's being sent, there are certain bounce back forms that will happen if it is something that needs to be served on the employee. So the vendor or you directly would be submitting the data. We would send back with the acknowledgement, the actual form that can then be printed out and served upon the employee. If it's something that does not need to be served on the employee, a specific form, then nothing is bounced back in those cases. But it's not like you are sending the EDI data, let's say for a denial, and then also filling out the old NOPLD form with denial information and sending that into us as well. Those old paper forms are going to be done with, and we will just be getting the information via EDI and then sending back the bounce back form.
Great. And just one other thing, I want to circle back to the prior question about seeing other carriers' information on Gillette claims or claims with multiple dates of injury, possibly different insurance carriers involved. Logically, the reason why you wouldn't be able to see other carriers' information for, let's say, a different date of injury but same body part is if it's litigated, you're going to have different interests. They're not going to always align with another insurer with a different date of injury. So they're not going to be able to tap in and see the information that you've provided into Campus. Likewise, you won't be able to tap in and see their information in Campus. It's kept separate based on the permissions, and that's because in that scenario you would have different legal interests.
Okay, we have one more question in the chat. Once a claim is filed EDI through a vendor, how long does it take for the information to be uploaded into the DLI portal?
Good question. So it'll depend on a couple things. Let me first say that when the information is submitted to DLI, when it is accepted, it should upload. We did a bunch of testing, and so some of our testing trading partners, if they were sending in thousands of claims at a time, it could take a couple hours for that information to be properly ingested and displayed. So it's not necessarily like snap your fingers fast, but it's pretty quick. And I would think, especially after the initial go live, when we would expect to see a lot of high numbers for submissions right away. When things kind of even out, it would probably take even less time. But keep in mind, because the beginning of that question, I think, asked about if you're sending it through a vendor, keep in mind that your vendor has timelines as well. So if I'm an insurance company and I am using a vendor to submit the EDI claims, I might submit them today, so 11 a.m. on whatever day this is. And it might get to my vendor today and they might need to process it and go through their own edit checks, and maybe it wouldn't go from the vendor to us until tomorrow morning, depending on their own timeframes. So if you're concerned, and obviously there's a lot of timeframes to be concerned about when you're filing things timely, maybe keep in mind and communicate with your vendor if there's any sort of a day delay or an hour, or whatever it is, that they need to process the data before they send it on. And then once it's sent to us, again, if it's accepted, it's a pretty quick turnaround.
I just want to say that these are all great questions, and I thank everybody in the audience for actively asking your questions. We purposefully scheduled this training session for the length of time that we did to allow for all of these questions to be brought forth. So if you have a question, certainly put it up in the chat box. Do we have any other pending questions?
Yes, there's one question from Linda. If as an adjuster, I decide to go into campus myself to advise TTD ended, then campus will bounce back and give me a form I then need to complete and send to the injured worker.
So when you are discontinuing benefits, in EDI talk, there is a suspension. So let's just talk about like a full suspension, a full discontinuance, not a partial right now. There is a suspension transaction called an SX that you would file, again, through either your vendor or you yourself, or if you're logging on to do it through the e-forms, to actually suspend the benefits. If you are suspending those benefits because the employee has returned to work, then that's all that needs to be done is the EDI filing, and a bounce back form would come back filled in with the data you submitted, or you could then print that out and send it as appropriate when it's needed. In cases where you're discontinuing or suspending for reasons other than return to work, there are the statutory requirements to make payment through the data service upon the employee and to the department. And because of those requirements and the EDI limitations, there is that additional web form that you would log into campus and fill out. So again, that's not on every suspension. It's just when the reason is for other than return to work. And in those cases, you fill out that discontinuance web form. And yes, when it is submitted, it creates a document that you would then, and the document even has like the attestation of service attached to it, that is part of that document, and any attachments that are uploaded. You would then print that out and serve it on the employee. But you don't have to refill it out. It would be filled out with the data that was submitted.
Okay, we have two more questions. So this is a technical question. It says, Minnesota accepts the AB MTC. What benefit type codes would be paid at the same time?
Good question. Really, the benefits that would be paid at the same time would be like a temp partial and permanent partial disability situation. So if you are currently paying temp partial benefits and you get that PPD rating, or there's a minimal ascertainable rating and PPD payments are due to start, you can file the AB to add the benefit type to say, we're already paying temp partial, now we're adding in perm partial. And then that's where the partial suspension comes into play too, because once you filed the AB, so now you're on a claim where you're currently paying temp partial and you're paying permanent partial. If one of those two discontinues, you would partially suspend and say, hey, this one benefit is suspended, but the other one is ongoing.
And the next question is, after a filing has been submitted via EDI, is it possible to print it into our internal files?
When a document is created for the filing, and some of it does depend on the document, yes, there is a documents, now this is where I'm still learning too, if it's a documents tab or the filings tab.
There's a download documents button, and I can certainly show that here coming up for everybody, if that would help, Melissa.
Yeah, so when there is a document created, you can in campus view that document, and when you're viewing the document, you can download it or you can print it out.
Perfect. It looks like Rick Henning had asked a question here saying, is the MMI date for the date MMI was served or the date the physician indicated MMI was reached?
The MMI date, if it says the date of maximal, yep, I see it there on the screen. It is the actual date of maximum medical improvement. So that is the IABC definition states it's the date of maximum medical improvement. When you can file, for example, the discontinuance web form, there's a specified date of MMI and then date of service, I believe, right on that web form. I'm trying to picture it in my mind right now. But yes, this is the date of actual maximum medical improvements. Most carriers do send in their service letter, and so we can see that letter kind of as an attachment, or you can upload it to the system, which is in the future training, even how to upload documents to the system. And then we can see the service date because we actually generally get a copy of that letter.
Right. So it sounds like what would be listed there under this key dates expandable section for date of MMI would be the MMI date as noted by the treating medical provider in their report, the IME opinion report, or presumed MMI. So it's not going to be the service date showing there. The service date is just when you pay benefits, indemnity benefits through. But what we'll be showing here under the date of maximum medical improvement, as Melissa said, is going to be the date that the doctor, the treating provider, specified MMI was reached, or the date that your IME opinion was saying that it was reached and served.
Okay. I have another question. My question is, if we have a vendor submitting the FRI for the is the adjuster able to have administrative rights to update and change information on campus?
So if you're using a vendor, you're not going to come into campus and kind of data enter in campus the changes you make. You will be submitting those changes through your vendor. So that will be the company's decision on kind of who has the rights to access your own system, update the data, and how that information is communicated to the vendor. So some companies will have it where if a data element is changed, so let's say I'm an adjuster and I'm going in and I'm updating the date of first day of lost time or the date of employer notice, for example, because I've gotten new information, I update that. My system might know to trigger that data change to the vendor and trigger that to campus automatically. Other companies might have it set up where you change that data, but you have to manually say, I want to get this sent over to the departments. That would be a business decision on your end.
And our next question is, if filing annoyed box 3, reasons for discontinuance other, we generally have to pay through the date of the suspension. Is this date when the EDI submission goes through, or when we submit the additional explanation the following day?
Good question. So this situation right here is the exact reason why we needed to create the discontinuance web form. Because if you were, especially if you're using a vendor and you're trying to fill out that form today, the suspension, and say I want to pay through today, the 13th of October, then I'm going to submit it to my vendor. It might take a day to get through the vendor. It might take a day to get over to campus. And all of a sudden you said you're paying through today, but we don't even receive it for 2 more days. And we're going to turn around and say, hey, you need to pay through the day we received it. And it was kind of this conundrum of how can you do that all on the same day when it needs to be shuffling through vendors or shuffling over to our system. So instead you will go on to the discontinuance web form, and that will be the form that you can say, I am filing this today. I'm paying through today. I can print this out and serve it on the employee all in the same day because it can happen instantly. And then your suspension information needs to also be filed. But if that suspension is filed on the same day and it does take a day or 2 to get to us, we are going to be using the discontinuance web form, the date that you say you're making payment through and serving the employee. And we therefore won't have to worry as much about the date the suspension is submitted to us.
Okay, our next question is, where do we find our group admin profile between now and go live to be sure it remains accurate? We may have had changes since then.
Sure. So the group admin surveys and the emails that were sent out to get that information were, that was the most, obviously you gave us the most up-to-date information at the time. If you have changes to that, you can email the work comp email address. I'm stumbling here to find it. It's like WCMP, please load on my computer, DLI.WCMP. I'll say that again, DLI.WCMP for work comp modernization project at states.mn.us. So if you want to email any changes or ask any questions there, that email address, the program email address, is the one that's monitoring the group admin profiles.
And one more question. Do we still have to fax in the healthcare provider reports, or do we upload them in campus?
You will be uploading those right into campus.
In circling back, it looks like a few questions up, we inadvertently missed the one from Kelly Wilner, the host and presenter. It says also what support will be available on the 11/2 go live date. Will there be extra staff available? a chat perhaps versus calling, which is hard to get through, and emails take a day or more to get a reply. Just curious. Thanks. So, Kelly, this is something that Deb Dolsky will speak a little bit more on towards the end of our presentation, but it's important that everybody understand that come 11/2 go live date, we're not going to turn off all of the assistance that we're giving in training. There will be resources available to help you and a campus help desk, and Deb will share those links and numbers with you here coming up towards the end of the presentation. So assistance in this transition is going to be ongoing post the 11/2 go live date.
Okay, one more question, and this is from Christine. It says, will the adjuster's assistants be able to upload files?
So that would be a business decision on your end. If you have an assistant who has a profile on campus and your group admin gives them access to the claim, then yes, they would be able to access the claim and go ahead and upload documents or other attachments that you might have. And then as far as like a file to the claim, like again, depending on if you're an e-form person and that assistant has access to actually submit the e-forms and do the data entry, you guys can certainly do that. Or if you are an EDI filer, the information that they enter in your system can transfer either to your vendor or directly through your system to us. But I'm guessing that was more about the ability to upload and stuff. And that is something that your group admin can determine and give to your assistants. Oh, and then just because I have the chat open, I see a follow-up question about it. Do they have to give access to every individual claim? Thankfully, no, because I feel that would take quite a while, I believe, for a lot of you. And this will be covered in more depth with the group admin training, but a very relevant question for this training as well. There is a bulk update where, for example, if you have a couple thousand claims and you want to go in and bulk select that your adjusters or claim managers or whatnot have access to all of them, or have access to all of them, and then you can remove a few things like that, you will be able to do it that way. It does not have to be claim by claim.
And just a reminder, there are a couple of group admin training sessions coming up, and at the end of the presentation, we will show you on the screen. Deb will point out where you can find those group admin training sessions, the dates, and get registered for them. Okay, I don't see any other unanswered chat questions. Do you see anything, Lisa? Do you have anything?
I do not.
Okay, so why don't we circle back and pick up a little bit where we were under, so we had just finished looking at the injury details page with the BCD codes. We finished that, so let's jump into the next section, the expandable section for accident details. And so here you can see where the accident premises was. It happened on the employer's premises, the accident site organization's name. You can see what type of initial treatment was sought, and here in this faux claim that was set up, they put minor by hospital clinic. And then also under this section, they list first date of disability after the waiting period, if that's applicable, if there's indemnity benefits that have been triggered. The next section that we have would be the employment details expandable section. And so here, this is going to show the employment status. So this person is full-time, shows their hire date. They're paid weekly, not biweekly in this situation. It shows their average weekly wage. It will show the work days scheduled. So this person here works weekdays, 5 weekdays a week only. And it'll show the workers' compensation rate and the occupation description for the injured worker and industry code. So that's the information that you can further hone down to under the employment details section. Now we'll go into the denials detail section. And remember, on this claim, when we looked into the claim overview section, it said claim denied by insurer. That was green and check marked. So knowing that, there should be some further information in this section here, denial details, that we'll want to take a look at. So here you'll see the denial effective date listed. So this claim was denied April 29th of 2020, which was the date of injury. Shows the denial reason. Looks like this is a partial denial. They're denying indemnity in whole, but not the medical. So you can see it's a partial denial, not a full denial. And you can see here the denial reason narrative that was used. Now, if additional information comes up when you're doing your due diligence and obtaining medical reports and witness statements, and you find that you're going to retroactively pick up the claim as compensable, the denial rescission date would be listed here. Okay. And the last section that's expandable for further information is the benefit and payment details section. So when we expand that, you can see if benefits were reduced, the reason for a reduced benefit. That could happen because the amount decreased, benefit was reclassified, maybe you made a prior overpayment that you're recouping part of on each future indemnity payment. That information would be listed there. Here you'll see information like if full wages were paid by the employer for the date of injury, if there was lost time. You'll see if the employee is receiving salary continuation from their employer in lieu of TTD wage loss compensation being issued by the claims administrator. And then here you'll also see if permanent impairment minimum's been paid. So if there's an injury type that the PPD schedule indicates that there is a minimum for, let's say, a back surgery type, if that's been paid, that would be marked there. Okay, so that is the last of the expandable sections.
Okay, Denise, we have one question.
Yeah.
It says, when will UR filings be needed? All claims on current 3.0 format?
I can answer that. Yep, and sorry, I'm looking at it too. So just as a heads up, guys, maybe check the Q&A in case there's other questions there. So we currently in EDI, we in our current system are on the 3.0 format, and we are moving to 3.1 for that version for EDI when we move into campus. And so the UR filings are needed to introduce those claims from our current system, the 3.0 into the 3.1 in campus. When they will be needed, if you are going to be making any sort of payments or working, if it is an active claim, we would suggest you file those right away within the first few days, first week. If this is a claim where benefits are not currently being paid or there aren't any timeliness concerns, and it is perhaps an open claim, you might have to file something on eventually. You can certainly wait and file it when appropriate. You don't have to file UR on every open claim right at the beginning. That would be probably a little overwhelming for your system and is just not necessary. So, but keep in mind that the UR is the first filing that will happen. So if you do need to, if you're sitting on a claim where you know you need to file what is today a notice of benefit payment, in the future would be a PY, a payment, you will need to file the UR before the PY or any other filing can be filed. So if you know that there is an active claim with active work happening, file the UR quickly.
Great, thank you.
And I see the follow-up sorry to interrupt. I see a follow-up here. If we use a vendor and have already submitted EDI with our vendor, is a UR still required? Yes, because the UR is what introduces the claim to the 3.1 filing in Campus, and your vendor, the vendors, this is what they do. So the good news is that they know what they're doing and they will certainly work with you and have a plan to get those URs filed to us. And then another follow-up question of, do all URs have to go through trading partner, or can the adjuster go into Campus directly and file the UR? The only time you would go in directly to file the UR is if you are a e-form trading partner, where you on your agreement have decided to not file directly or file through a vendor. You have decided to file using the e-FROIs and the e-SROIs. And then yes, you would go into Campus and submit the UR in that manner.
Great. So I want to show you this last section of tabs here at the bottom. But before I do that, just because we've been on this page for quite some time, I wanted to remind you all what page we're on and how we got here. This is the claims detail page. So we'll just come back into here. I'll click on the Campus homepage. We got here to the page that we've been looking through, the expanded information and the tabs in the claims overview page. When we were on the Campus homepage, remember we scrolled down and we clicked on the hyperlink for the Campus file number for Monday Tester. So that is how we got to the screen that we've been in going through further details for quite a while. That's how we got here, just to remind you all what page we're looking at. And then that page is always the same format. It's some summarized information up top, tells you the status, if it's open or closed. And then we have the sections here with all of the further information if you choose to expand it. And then at the bottom, this is the final section that we're going to go through next and talk about what you can see in this claims detail page. So let's start with the Parties tab. And so on this claim view screen in the Parties tab, when it's selected, you'll see further tabs break out below. And that shows the employee, again, gives their WID number. The EE dash number is their WID number. And that number stays with the employee for their lifetime. So an employee is going to have one WID number in their lifetime, but they could have multiple claim numbers. But that one WID number will always stay the same. If we click on the Insured tab, you'll see who the insured is. You can click on the Employer tab and see various information for the employer. And you can see things like their service method. If you click on the Insure tab, you can see that this claim is underwritten or insured by UAT, another one insurer. If they were a self-insurer, it would say that there. And then if you want to see who the claims administrator is, that would be listed here. It looks like they handle their own claims, so they don't have a third-party administrator entity handling their claims. They handle them in-house as the insurer. So those are the various things that you can see for tabs underneath the main Parties tab here. If you needed to contact the parties, let's say the insured, you would click on this Contact Parties button there and select who you'd want to email. You could email all parties. So that's a quick link to contact them. The next tab we have is the Claim Summary tab, and this is to show you all of the related transactions to the claim. As this is a fake claim, we don't have any additional related transactions listed here, but if there were some in real life on a real claim in the actual Campus production system, you'll see that information there. The next tab is the Benefits tab, and that shows the reported benefits summary. and reported compensation details. So you can see it's going to show total amount of benefits paid, total amount of indemnity benefits, any other benefits paid. Under this section here, the reported compensation details, you can see here it'll show what their work comp rate is. And when you scroll down then under the benefits tab, you'll see there's the indemnity benefits, the type. It would be reported here if payments were made for, let's say, TTD, total temporary disability, or TPD, temporary partial disability, or PPD, if there was an impairment that was paid. You'd see that there. Okay, and the next tab would be the Documents tab, and this is the tab where we had a question earlier asking, let's say a claims adjuster wanted to download a document on a claim into your own system. Let's say you have a paperless file system. Let's say you want to download another copy of the DSR, the Disability Status Report. You would just, under the Documents tab, click on the hyperlink for the document ID, and then let it populate. And here, because we're in the test system, not the actual production system, it's not going to really populate that for us to see because there is no actual DSR document in our pretend system here. But let's say that there was a DSR that populated, and it would populate when we click that button there. Then we would click when we're in that Documents tab, we clicked the DSR to pull up the document. When it loads, then, if we wanted to download that as a claim rep into our own system, you would click this Download All Documents button here. And you can save that into your own system so that you have that saved in your system outside of campus if you want it. Okay. The next tab is the Related Claims and Cases tab. And this is going to show the employees related to claims and transactions. So here you have a voc rehab transaction listed, and you also have a dispute, which is a medical dispute. Okay, and the next tab is the reporting history. And you can see here the source was eForm for these two. So we have a partial denial that was filed, and we have a new first report of injury, an 00 or 00 form. And so basically this section here under reporting history tab, this is going to show all the EDI or the EFROI, ESHROI, the subsequent report of injuries. It'll show all the MTC transactions that have been reported on the claim. And so the last tab under this section is the Claims Payments tab. And that is basically a summary of, as you can see here, all the claim payments made, all the benefit payments made, other benefits paid, and then any lump sum or settlements paid. If there was litigation and if it was resolved via an award, you'd see that figure there. And then if we scroll up to the top, let's say that you decided you needed to submit a filing. You do that activity on the upper right-hand side of that screen by clicking the Submit a Filing button. The box pops up where you'd indicate the type of filing that you're wanting to make. Now, the options that pull up when we click this drop-down menu, it's going to be specific to the claim type. So the options are going to be different depending on the claim type as it was set up. And it will be associated to the transaction. So here, under the Monday Tester claim, which is medical only, these are the items that pull up as options for filings that we could submit: an annual claim reimbursement request, dependency information, disability status report, a discontinuance form, could initiate a dispute, missing benefits, an other filing, PPD follow-up web form, or a voc rehab unit referral. So you'd select the option that you wanted to submit the filing under. You'd click Save. And then basically, let's say that I'm done working in campus. You'll notice that it will time you out periodically if you idle on the screen too long. And then you just have to log back in. It'll go back to the main screen where you put in your account name and your password. But when you're done working in the system, you'd click under the right-hand side. Remember, my name is, I'm Tuesday Another. So where your name is, the upper right-hand side of the toolbar, the drop-down menu, you would click on Log Out. And that would take you out of campus, log you off. And so we've concluded the demonstration portion of today's presentation. As you all know, the campus system go live date, it is coming up on Monday, November 2nd. And we're excited about the enhanced capabilities that this new campus system offers. And we thank you all again for allowing us to share some more of those functionalities with you today. And Deb, did you want to share some helpful links to our training resources?
Yes, I will. I'm going to copy and paste the links into the chat, and then Denise, if you can bring up the link, we can kind of go through what we have.
Okay, so you're going to post the link in the chat box, and then I will show everybody on the screen where you can maneuver to that. So the first one.
Okay, so this is an overall view of Work Comp Campus. If you want to slide down a little bit,
Yes.
Denise, keep on going down. And this is all the various entities that are involved with Work Comp Campus, with the campus. So you've got, you know, the employees, employers, healthcare providers, and such. And if you were to click on either one of those entities, you would see the various applicable topics for them. I also wanted to show you on the very bottom, there's a various sign up area where you can be placed on various email lists for various updates. So take a look at that to see if you haven't signed up for any updates on workers' comp from the department. Take a look at that and sign up for that information.
Great.
Okay, and then I'll send you another link. If you can pull up that one.
Okay.
Now, this is a Work Comp Campus specifically identified for insurers and self-insureds. And it basically describes information that you will need to know. And it also will give you, if you keep on sliding down, this is go back up. Melissa has been talking about campus answer hours for self-insurers and such. Here is a breakdown of the prior presentations and upcoming presentations. You will also note that there are various quick reference guides that are noted in there as well. How to join, there's instructions of how to join those campus hours for your information as well. So just kind of take a look at that. And if you want to go down to the very bottom, you're good. Again, this is information. If you want to get updates on it, subscribe to the adjusters update email list. This information is very valuable to everybody. So if you're not on there already, please join up so you are given all the updates that we are presenting to the state on workers' comp.
Great. And just a reminder, you can see here is the email address, dli.wcmp@state.mn.us. That's been called out a few times during today's presentations. That's where you would email if you had questions about campus.
Okay, and I just put on another link.
Okay.
And this is a link for the Work Comp Campus training. As you can see, the various training sessions for the various entities. In our discussion today, there had been numerous conversation about the group management. And you can see here that the upcoming next discussion regarding the group is tomorrow.
And that'll be given by Melissa Parrish.
Correct. And if you can't make that one, there is another session that is scheduled. You want to scroll down a little bit. If you can't make that one, for October 21st. And again, these will be recorded. So if you cannot attend either one, they will be available on the website. So you could see all the various entities and their upcoming scheduled sessions for training in campus. If you want to go down a little bit further. Denise?
And I'm just going to jump in quick to say that actually the group management is going to be done by Angie Andreessen, who's the project, the management analyst for the project. And so she'll do a great job of that.
Great.
Thanks, Melissa.
Thank you for clarification. Thank you.
Okay. And then it goes for the resources that we have had already. So that is the prior sessions that were recorded, and many of you may have attended those previously. So that is available for your review as well. We also had spoken to the various, this one right there, the MTC guide. If you want to click that on, we can just quickly go through a snapshot view of that. So this will give you, it's the whoops. It'll give you what the old, move it up a little bit, Denise, to the table. No, move, no, up further to the very, okay. So you see where it says maintenance type code, MTC definition, and current form. So the line on the right is what we currently have. And then on the left will be what it is in the new campus system. So take a look at that, and what I've done is to make a copy of that and print it alongside so you can get used to the different numbers and such going into the new system. I think it's about 3 pages long. So I wanted to let you know where you can find that out. And I think sometimes they call this guide the crosswalk. Melissa?
Yes,
so it's crossing over from the current system to what everyone's working with now to what campus is going to be. So that's the crosswalk. Okay.
It is 3 pages. Oh, a little bit more. Okay.
Okay. And then if you want to back out to where we were before.
Yes.
Okay. And then go down. No, we were on a different one.
Okay, no worries.
I think it's this one. Okay. And then the next link is the external technical manual. This is a manual that's going to walk you through all the processes that you will need to work on in campus. So this is an extremely beneficial tool for you to get to learn to know the various processes and procedures in campus. I believe that is like 129 pages. So take a look at that as well. On the various following reference guides, you can take a look at and see exactly what other guides are available to everybody. And again, if you have questions, the link or the email address is listed under there.
And the phone number, if you have any questions, is in the bottom corner here. And when you're in the actual campus system, if you'll recall, I showed you it was at the very bottom of every page. You scroll down to the bottom. So if you have questions going through this, go ahead and give a call. We do have a campus help desk, people set to help when we go live.
And Denise, I just put
Can we
another
address
one
just
on
a couple
chat.
questions from the chat?
Okay.
Yes.
There was a question about to sign up for the adjuster updates. It's asking for a password. Can you clarify if you were signing up for the adjuster like email updates, or if you went for one of the trainings? If I catch it in the chat, I'll just try and respond to the chat as you guys move on.
Okay.
One other thing, it looks like somebody was asking who should attend the group management presentation. On this screen here with the link that Deb showed us, there is a chart which says, what work comp campus training do I need? So if you click on that, it'll load and tell you, depending on what entity type you are, what your role is, which things they'd suggest that you take as far as training. So that can be a helpful tool.
Yep. And the emails were sent out, again, a survey and email to each entity to determine who the group admin would be. So it's those individuals who will be the group admin who should go to the group management training. So if I had my own insurance company, every single one of my employees does not need to attend that training. It would be meant for the people identified to be the group managers, the group admin. So maybe check with your team, or if you're in charge of your team and you need to make that determination, show on up and determine who needs to come. I'd have at least a person or two as a backup to be able to attend that training. Let's see.
Deb, was there anything else?
I gave you another link to look at.
Okay. And we'd suggest that y'all might want to cut and paste these links and then save them as favorites into your system to use going forward. Okay, Deb.
And this one here is, if you haven't signed up for this already, this is a valuable tool which will also give you various updates. So sign up for CompTAC, and we'll put you on the list and have you get all the updated information about the various changes and emails that we have alerting everyone to changes for work comp or helpful hints. The most recent one is COVID information. That's been very beneficial for everybody.
All right. Anything else that you'd like me to maneuver to, Deb?
I just added the telephone number for our help desk and email for everybody. When you call the help desk, it's option 3 via the direct or via the toll-free number 3, option 3, plus the email desk. So feel free to give us a call or email us, and we're here to help everybody out in this transition.
Great. And it looks like Steph Coots would like to see again where to find the external technical guide. So let's do that.
It's under the training one.
That would be this one right here, this link. We scroll down to the bottom, and it's right here.
There you go.
So when we click the hyperlink, you can see this is the, Deb, what you estimated 129 pages.
That's correct.
So maybe we won't wait. Oh, there we go. I was going to say maybe we won't wait for it to load, but there you go. So this is a good thing. You'll want to save this as a favorite probably to help you as you maneuver through the new system. And it breaks down where to go for the different topics that you might have questions on. Any other items in the chat box?
I think we were following up with all of them okay, and I think we're doing good.
Okay.
And I do know we're over, so people can certainly drop, but at least some of us can stay on. If someone is still kind of typing a question and trying to get it out, we'll stick around for a few minutes to wait on that.
Okay. Deborah, Melissa, did you have any closing remarks that you want to add?
No, thank you for all the questions. We do have upcoming training sessions on that website that Denise and Deb were just going over. I will point out that some of the upcoming trainings, like how to upload a form, it's one aspect we're going to show you, and it probably wouldn't take a very long time. And we did that on purpose so that we can have a lot of questions. So if we didn't get to your question today, or if you think of something else moving forward, please do attend future trainings, and we will have, again, lots of time for questions, because I think that's a really important part of what we're doing right now.
Great.
I just want to thank everybody for attending, and we're here to help you out, and everyone had good questions. So again, if you have any questions, feel free to reach out to us.
Definitely. Thanks, everyone.
So our training is concluded. The presentation is concluded. Thank you, everybody, for taking the time to attend the presentation here today and asking all of the helpful questions. Please note the panel will stay on this WebEx for a few minutes more.